Hi, Eileen Bayer, the fam here. Welcome to episode 3 in our Major Depressive Disorder Mental Health mini-series. And in this episode, we are going to be covering the diagnosis for Major Depressive Disorder and the treatments for it. So let's begin. There's 4 different ways that they will diagnose major depressive disorder. There's 4 things that they do, and one of them is they'll give you a physical exam and ask questions about your health to make sure that there is no underlying physical condition bringing on your depression. The second thing that they'll do after they do that, they may run a lab test called a complete blood count. And the reason for that is to make sure that your thyroid is functioning properly, because if you are having problems with your thyroid, that can cause depression also. So that's why they do that. The third way is to somebody in the mental health profession by giving a psychiatric evaluation where they'll ask you about your symptoms, your thoughts, feelings, and your behavior patterns. And you may be asked to fill out a questionnaire to answer some questions so they can determine if you do have major depressive disorder. And the last thing that they do in the diagnosis is called a DSM-5, which is also done through mental health. And it's just criteria that they use that's listed in the Diagnostic and Statistical Manual for Mental Disorders that's published by the Psychiatric Association. So we're doing all 4 of them will cover anything that may be causing depression. Now, there's different types of depression, and there's at least 7 different types of depression, and we're also going to cover each of them 7 different types to give you an example of what it is and why they need to do all these tests. Okay, some symptoms from depression, they're different from person to person because we're all made differently. So what one person's symptoms may be may not be what somebody else goes through. So, that's always important to know. To identify, excuse me, let me get a drink of water here for a second. My mouth is dry. Sorry about that. Okay, to identify them, they need to look into them, and we're going to go over the 7 different types. One of them is called anxious distress, which what anxious distress is depression with unusual restlessness or worry about possible events or loss of control. The second type of depression is called mixed features, which is simultaneously depression and mania, which includes elevated self-esteem, talking too much, and increased energy. You also have the third type, which is melancholic features, which is severe depression with lack of response to something that used to make you happy. And it's normally hit you in the early morning time when you wake up. Your mood will be worse, and it will cause major changes in your appetite, feelings of guilt, agitation, or sluggishness. The fourth type is called atypical features. And what this type covers is depression that includes the ability to temporarily be cheered up by happy events, increased appetite, excessive need for sleep, sensitivity to rejection, and a heavy feeling in the arms or legs. So your body feels real heavy and all you want to do is sleep. You're not really hungry. And that's what that one is. The fifth one is psychotic features, which is depression accompanied by delusions, hallucinations, which may involve personal inadequacy or negative themes. So that's what that one is. And then you have catatonia, which is depression that includes your motor activity that involves either uncontrollable and purposeless movement or fixed and inflexible posture. So that one involves your body movements, and then you have the postpartum onset, which deals with, it occurs during pregnancy in the weeks or months after the delivery, which is postpartum. You heard, it's called postpartum depression. Not everybody gets it, but some people do. And they can do crazy things with it. And then the last type is what they call a seasonal pattern. And what this one is the depression related to changes in the season and reduced exposure to the sunlight. So those are the 8 different types of depression. Now, there are other disorders that cause depression symptoms, and we're going to cover them. A lot of these we covered in our earliest ones, but we're going to go over it so it refreshes your memory a little bit, and you'll know some other things that causes depression. Several other disorders, such as what I'm going to mention, include depression as a symptom. It's important to get an accurate diagnosis so you can get appropriate treatment. Of course, what we're talking about is if you have something other than depression, because there's other mental disorders that cause it, it's not going to do any good if they just give you medication just for the major depression disorder, if it's something else. Bipolar 1 and 2, these are both mood disorders that include mood swings that range from the highs, which is called mania, to the lows, which is depression. And it is sometimes difficult to distinguish between bipolar disorder and depression. Cyclothymic disorder involves highs and lows that are milder than those of bipolar disorder. And if you remember, we covered all 3 of them in our earlier episodes dealing with bipolar 1 and 2 in that one. Another thing is disruptive mood dysregulation disorder. Now, this disorder is, I'm trying to read my notes for a minute because it's hard for me, so please bear with me a moment. Okay, this mood disorder in children. This occurs in children now. It includes chronic and severe irritability and anger with frequent extreme temper outbursts. This disorder typically is severe and develops into depressive disorder or anxiety disorder during their teens or early adulthood. And then you have the persistent depressive disorder, which is sometimes called dysthymia. Excuse me. This is a less severe but more chronic form of depression. While it's usually not disabling, persistent depressive disorder can prevent you from functioning normally in your daily routine and from living your life to the fullest.